Welcome everybody to the AANEM Neuromuscular Fellowship Fair. We're excited that you're all here to join us tonight. We have 4 programs we'll be presenting for us. So we have University of Rochester, New York, University of Vermont Medical Center, University of Virginia Medical Center, and Virginia Commonwealth University Health Systems. Each program will be giving a brief presentation. When the programs are done, we will then jump into a question and answer session so that you can ask questions to the programs, whether it be an individual, to everybody. There may be some fellows on board here that would be willing to answer some questions. So whatever your question is, we'll utilize the chat feature for that. So you certainly can ask a question throughout the presentations. Just know that we won't be answering any of them until the very end. All right, well, let's go ahead and get started. Thanks again for joining us, everyone.
Okay, so welcome. My name is Emg Chaffelone. I'm the program director for the Neuromuscular Medicine Fellowship at the University of Rochester, New York. We also have Karen Lee, who's going to be able to answer question at the end, and she's our fantastic program coordinator. I'm going to tell you a little bit about our program. So Rochester, we are in Rochester, New York, not to be confused by the lesser Rochester of Minnesota, so to speak. And we are a mid-sized city. So in the western part of New York, one of the great things is that you have many advantages of a pretty big city, and yet very easy living and very low cost of life. You can see also that we don't have any significant commuting to get to work and to get to the hospital. Our housing costs are quite low. Certainly for New York State, very much. We're very close to major cities, including Toronto is right across the lake. And we're not that far from New York City, Toronto, and other interesting cities. Our airport, then I think is very efficient and very short security lines, although now is not a big not that important, unfortunately, because of all the restricted travel for now, but it is a nice little airport, very easy to get in and out, no stress there. And sorry, my slides are not behaving the way they should. Anyway, I wanted to give you a little map. I think it's because it's not on slideshow. There you go. So we are situated right here. So I crossed from Lake Ontario, and we are very close to the beautiful region of the Finger Lakes. So this is Western New York. So Finger Lakes, if you're an outdoor person, they're really beautiful for wineries and hiking, and we have beautiful fall, and we have all 4 seasons, so we don't get just the snow. And we're close to Buffalo to the west, which is a nice little city. And then to the east, we have, you probably have heard of the Adirondacks, again, beautiful outdoors to explore for several activities, including skiing at Lake Placid. So that's the geography. Our hospital is, you can see here some numbers. So the beautiful thing is that we have our Strong Memorial Hospital and our Golizano Children's Hospital. They're actually physically in the same place. They're connected. There is no driving in between different facilities or clinics. It's all in one campus, one building, so no driving around. And we are very much high in the United States in terms of NIH grants and research, almost 1.2 billion for research grants. And coming to the Neuromuscular Medicine Fellowship, just briefly, is really that what it comes down is, I think that one of the outstanding features is really our faculty that is really philosophically deeply committed to education. And this is really because of the whole department is really pretty much The philosophy is based on learning and teaching. We do have a structure and yet flexible curriculum. And so we have enough flexibility with the research time that is built into the fellowship to really carve whatever a fellow career plans are in terms of what they want to get exposed to. We are very hands-on, very comprehensive clinical experience. I think that one of the big thing is that the broad range of diseases that you will see during your year of fellowship here really spans from newborns identified through newborn screening for SMA. We have been screening for more than 2 years here in New York, to, you know, ALS, IBM, periodic paralysis. We are not specializing just in a few neuromuscular diseases, but we have a very broad range of diseases of all ages, pediatric and adults. And we do have very structured lecture series, including a monthly journal club that in the good old times used to happen at the homes of the different faculty, and we'll rotate. And now, of course, it's all Zoom, but hopefully we'll resume in person in the near future. The other thing is that we have 12 faculty in neuromuscular, and we have several very, very well established clinical research and translational research program. Some major example that you can browse on our website is the myotonic dystrophy, FSHD. They are internationally renowned, myasthenia gravis, pediatric diseases, you name it, periodic paralysis. We were among the first centers to do clinical trials in that disease. And Rochester, it's an easy place to live. And I think that the university in general, but especially the Department of Neurology, really has a very strong emphasis on work-life balance. So we are very busy during the day, but fellows and residents have a very nice life outside the work. The level of stress is very, very low overall. Like I said, there is no driving around. The EMG lab, all the clinics, the pathology lab, all the rotations are in the same building. Because we do have 3 fellows each year, call for after hours and weekend, which is very, very mild anyway. You only share 4 months per year. And also we have in the past several years 100% first time pass for the neuromuscular medicine boards. So we do have 3 positions of 1 year for the fellowship. Many of our fellows come because they're also attracted by our experimental therapeutics fellowship program, which is pretty unique in the country, and that is a training program for experimental therapeutics clinical trials. We have now 12 faculty members in the division of neuromuscular, 3 nurse practitioners, 1 nurse, 2 physical therapists. 1 is actually a PhD faculty. 5 or 6 highly experienced EMG technologists that the fellows work very closely with. We had a genetic counselor, adult and pediatric social workers. So the sense here is obviously we have a whole strong infrastructure that really cater to learning, but also to work efficiently for the fellows. And these are just some pictures. You can see, you know, many of our faculty in the left upper panel. Sometimes we also party. We have endowment parties, so we do clean up pretty nicely. And in some of these panels, you can see also some of other faculty that participate in our multidisciplinary clinic. We have pediatric and adult pulmonologists, cardiologists for our Duchenne and complex clinics. So in a nutshell, the clinics that the fellows participate in are for Monday morning and Thursday morning. They are working in the hereditary polyneuropathy, CMT, and acquired polyneuropathy clinics. So that's 2.5 days a week. We have then Wednesday all days our muscle clinic with also ALS and pediatric neuromuscular Duchenne, SMA, newborn screening program, including Pompe and SMA. Our clinics have received accreditation from the Cure SMA, from PPMD for Duchenne, MDA grant for a very long time. We are also certified New York State newborn screening for SMA and Pompe. We have an ALS multidisciplinary clinic that is sponsored by both MDA and ALSA, and also the Myasthenia Gravis Foundation of America. We have recognition as a center of expertise for myasthenia. Our pathology lab for muscle and nerves, our directors are Dr. Herman and Dr. Tawil. We do about 200 muscle biopsy a year and about 500 skin and nerve biopsies a year. And our EMG laboratory is accredited through the AANEM. More than 3,000 studies per year. We have now 3 machines for ultrasound, both for nerve and muscle. We do about almost close to 500 ultrasounds a year. We use Nicolette EMG machines, and we have 2 locations, but the fellows mostly work at the main EMG lab that has 4 EMG rooms, and that is at the medical center. And they will be exposed to several different faculty. Obviously, we only have 10 minutes, so I'll be glad to take any question later on. And I will encourage, if you have any interest, to browse our website that is listed here, and also to feel free to email either myself or Karen Lee, who's our program coordinator, anytime with any question. And we will love to have you come and visit, if at least virtually. And I think that's all I have. Thank you.
Well, thank you to the AANEM for having us tonight. It's very interesting to talk right after Emma, being that I did my fellowship with Emma and she's one of my mentors. I thought our placement tonight was very funny. I also did my residency at UVA with Kelly and Kira. So it's an interesting evening. But I'm going to talk about our fellowship in Vermont. If I can get my slides to work. We're located in beautiful Burlington, Vermont, right on Lake Champlain, which is one of the biggest non-Great Lakes in the United States. It's one of the longest lakes in the United States, and we live across the lake from the Adirondacks in New York, and then just west of the Green Mountains in Vermont. It's a picture of the medical center at UVM, and we run our EMG lab, or Inpatient Neuromuscular Experience, out of the hospital there, and then 1 block away we have our general neuromuscular clinics. And Vermont is a little different than some places. We're more of a rural state, rural population. Burlington is very much a smaller city, but we have a very large catchment area in Vermont. So we often will see patients from as far south as Albany, New York, and as far west, almost up to Syracuse, New York. We have this big area that we draw from. And our hospital serves about 1 million to 1.5 million people in the state of Vermont and in the state of New York. And then we'll see some subspecialty patients come for neuromuscular care from New Hampshire, from Maine, and then occasionally from the province of Quebec across the border. And because of that, we see a wide number of patients and neuromuscular disorders, even though we're a smaller center. So I think I want to lead with our faculty, because I think that's really one of the strengths of our program. So we're a smaller hospital, a smaller neurology department, but we have a relatively large neuromuscular faculty for the size of our state. So we have 5 neuromuscular trained faculty neurologists, and then we have a neuropathologist who has specialization in nerve and muscle pathology on our team. I've been directing our fellowship for the last 3 years. And our program, I think, is a very, sorry, I'm having an error on my screen. It's a very, I think it's a very friendly program. It's a smaller program. We only have 1 neuromuscular fellow per year. We will also have a clinical neurophysiology fellow at the same time. So there's some overlap with those 2 in the EMG lab. But I think the nice part about being at a program with a single fellow is that you get all the attention, and we can tailor the program to each particular person's needs and career goals. And I think you know, we're able to make research experiences for those who have that as an interest. We're able to focus down on more clinical work for those who are planning to go into practice. And we can vary the diagnostic portions of the fellowship as well. But I think it's really a friendly group. I think our faculty are friendly. We get to know our fellows very well. We get to know our residents very well in Vermont. And everybody sort of complements each other in our group. So I do a lot of research in myasthenia and neuromuscular junction disorders. Dr. Fries and Dr. Kolb, in addition to their work in neuromuscular, they also direct the clerkship for 3rd and 4th year medical students at UVM. So they're heavily into education. Dr. Fries focuses on EMG. Dr. Kolb is a researcher in neuropathy, particularly chemotherapy neuropathy. Dr. Tandon is an expert in ALS and has been running our very successful center for many years. And Dr. Wahid is an expert in inflammatory neuropathies and also directs our MDA program. It's also nice to have the clinical vice chair in our division. And then Dr. DeWitt trained at the MGH and Brigham program for pathology, and has a special interest in muscle and nerve pathology, so works very closely with our fellows as well. So at our smaller center, we have neuromuscular centers of excellence in myasthenia and ALS, inflammatory neuropathies, inflammatory myopathies, and muscular dystrophy. Our fellows, I think, have a very comprehensive fellowship experience. It's the way that I trained, and it's how I've tried to set up our program here. With a typical week for a fellow would be 4 half days of clinic, including a neuromuscular, a more general neuromuscular clinic. We in non-COVID times run a comprehensive myasthenia clinic, and then we have both the ALS and MDA programs that run, and the fellows lead those when they're in those clinics. There are also 3 to 4 half days of electrodiagnostics, including EMG, neuromuscular ultrasound. We also have a full autonomic testing lab in our lab. So if that's an interest of somebody, they can participate in that, where we have Q-sweat and we have tilt table testing available. And then our fellows read muscle and nerve pathology a half day a week with John DeWitt, and then are also expected, after they've been reading pathology, to also participate and lead a teaching session for our neurology residents that runs once a month, where they show the slides and we look at them as a group as well. And then we have an inpatient consultative service for neuromuscular admissions. And our fellows get very involved in that and work closely with the residents on the floors to help direct care when patients come in with neuromuscular emergencies. We don't have any weekend or evening call. Everything happens during the workday, so your free time is your own to study or to enjoy Vermont, which I'll show you a little bit about in a second. we have a number of neuromuscular conferences that are running. We have a regular neuromuscular medicine lecture series that runs twice monthly. We usually have our fellow give 4 lectures in that series, just as part of, you know, growing up and becoming a fellow, moving on to an attending. It's good to get some teaching experience. So we have people do that. When they give those sessions, we always have one of us partner with the fellow to, you know, bounce ideas, look at the presentation in advance, and also just attend the lecture to see how they do and fill in any gaps there might be. We also have an Emg Didactic Series that runs twice monthly for the neuromuscular fellow and the CNL fellows, and often our EMG techs will attend that conference as well. And then we do also have a neuromuscular journal club, which typically meets at a lunch hour once a month. And then, as I mentioned, we have a neuromuscular pathology conference where we review all the muscle and nerve pathology as a group, including residents, fellows, and all the neuromuscular attendings. And I think that's really quite a good conference for the fellows, because you get a chance to teach what you're learning in the pathology lab, and that really sort of solidifies the learning experience. For those that are interested, we have a very strong interest in research and also getting our trainees involved in research projects while they're with us. For fellows who are interested to do research while they're with us for the year, we will protect your time so that you have time to do it. We have funds that you can travel to a meeting and present your findings. And these are some of the folks at UVM who've done some research with us over the last couple of years. One of our medical students won one of the Young Investigator Awards at the AANEM a couple of years ago. And we almost always have both poster and platform presenters at the AANEM and Myasthenia meetings each fall. And we expect our fellows to do this. We love to do research, we love to teach, and we like to get the fellows involved. And then last but not least, one of the best parts of training in Vermont is that you're in Vermont, which is a wonderful place to be and to play when you're not at work. In Burlington proper has a nice downtown, which actually looks a lot like Charlottesville, which I'm sure you'll see a picture of in a minute, because I think there was the same architect designed both of our downtowns. And there's a lot of farm to table restaurants. We have a waterfront, which is beautiful in the summer for biking and boating. And then in the winter, skiing is big. Outdoor sports are big in the winter as well. People get excited. We're in the middle of a nor'easter right now, getting a lot of snow, and people are excited about it because this weekend the skiing is going to be fantastic. So it's a fun place to be. I know that our residents and fellows get out and are able to enjoy things. So I hope that you give us a look. There's a lot of fun things here in Vermont, but I also think that we have a strong program where you can grow as a clinician. Please check out our website, and we look forward to hearing from you. Thanks.
So I'm here to talk. I'm the Neuromuscular Fellowship Director. You can see a picture here of our medical center. Certainly we're located in Central Virginia, just in the Piedmont of the Blue Ridge Mountains. It's not as, also Four Seasons, and it's a beautiful small city like the other ones that we've just talked about just a few slides before. So I'll kind of change it up and just talk about our division. So our division's relatively small as well. So our division head is Dr. Goran Rakocevic, who was previously at Jefferson, and he does a lot of ALS. I am the fellowship director. And then we have Sarah Jones and Matt Elliott that help us out a lot. Dr. Ted Burns, which a lot of people here know, he's still working a little bit as much as he can through his illness. But he's a great person to have. And then the director of our EMG lab that started in 1983, Dr. Phillips, still does a lot of teaching for us and the fellows, and he's a great resource. Otherwise, we have associated providers that are not within our division, but Dr. James Mandel in neuropathology, Dr. Rebecca Scharf, who's a developmental pediatrician and heads up a lot of the pediatric MDA clinics, as well as a lot of the management of pediatric SMA. Otherwise, currently just trying to develop more pediatric neuromuscular with a specific strategic goal, but nothing that's set in stone as of yet. We have one physician's assistant. We have a lot of therapists that are collaborating with us in the management of ALS, as well as our Mda clinics. And we have 3 EMG technicians. So the program in general, the neuromuscular fellows, which we are accredited to have 2 fellows, are paired up with 2 clinical neurophys EMG fellows. So there's a potential for having 4 fellows at any given time. So there's time shared between the EMG lab as well as neuromuscular clinics. They're not divided into specialties per se. Most of them are general neuromuscular clinics, other than ALS clinic that happens 2 or 3 times a month. We are a certified treatment center of excellence in ALS. We have an adult MDA clinic that meets monthly. Pending cases, we have neuromuscular pathology for the neuromuscular fellows that they're expected to participate in meeting nerve and muscle pathology that's both internal and external. The fellows are expected to participate in clinical research trials. Currently, we are part of the NEALS consortium, and so there's ALS clinics, ALS trials, as well as myasthenia gravis trials and trials in inflammatory myopathy. We're also a center of excellence by the GBS and CIDP Foundation. Neuromuscular fellows can participate in neuromuscular ultrasound, not high volume at this point in time, and also for interested fellows, participating in single fiber EMG should it be part of the interest. Other elective opportunities that are just depending on what the fellows would like to do, whether they want to work a little bit longer in the pediatric clinic in developmental pediatrics, palliative care, which one of our fellows was quite interested a couple of years ago, and whether there's any research or special interest, certainly depending on the number of fellows we have in any given year. So didactics, we have weekly conferences with the residents and the fellows, which Kelly and Mike, I guess, remember. Then other than that, literature review and readings with the program director. And that's a collaboration between the clinical neurophys EMG fellows and the neuromuscular fellows. There's a journal club during lunchtime hours and during the division meetings. Neuromuscular pathology, that is more of a conference for the residents and the fellows, and all the neuromuscular faculty attend. And much like Mike was talking about, there is the neuromuscular fellows and the EMG fellows present cases and share their learnings. And then grand rounds every Friday. One of the things that, with everything that's been happening and sort of things in the news about Charlottesville, it's important to notice that certainly UVA is trying very hard to improve our diversity and the importance of diversity in both residents, fellows, and faculty. So we do have a diversity committee for the department that ensures that we try to be as diverse as possible. So there's information here and a picture of the folks that make up that committee. A few of the sort of benefits from the perspective of the GME office at UVA, and people can see here, and I won't go over and belabor the point of the bullet points per se. There is financial support to attend conferences and time as well, should fellows feel inclined for education and also to present. So those things are available. There's additionally, there's a child care center that's associated with UVA and that takes preference for residents and staff to be able to help for daycare as well. Our neuromuscular fellowship has not been around very long, but so far a lot of the collaboration with CMP, EMG as well. So some of our recent graduates have taken academic faculty positions and also community and practice positions. So moving on to a little bit about UVA. It's a small town and a small city, like much of the other ones that we just discussed. There's a better picture of the downtown, I guess, that Mike was talking about, as far as similar to Burlington. But there's a lot of outdoor activities to be had. And so wineries and breweries, being at the foot of the Blue Ridge Mountains, a lot of hiking trails, and the Shenandoah National Park nearby. So a lot of the folks that come to our program are outdoor enthusiasts and either interested in running or biking. Additionally, there's a lot of opportunities for history. A little bit more about outdoor concert series. Picture on the bottom left is a recent graduation from one of our recent fellows and some of the folks that do participate in the management of our patients. So outside of UVA, again, Central Virginia, we're not too far away from the beach and not too far away from the mountains. Travel is fairly easy, both international and national, either in Richmond or through Dulles if necessary. The catchment area for the patients goes as far as northern Tennessee, West Virginia, and a lot of the Southwest and Western Virginia. So even though it's relatively small, we have a diverse amount of patients that come to see us. A few fun facts about UVA, and overall, we're a small program, but a lot of people that are very interested in education. And otherwise, I think I will wrap it up and we'll answer questions thereafter.
Virginia Commonwealth University is located in Richmond, the capital of the Commonwealth of Virginia. Richmond has a diverse population of 230,000 people in the city proper and 1.2 million in the Richmond metropolitan area. Richmond is at the fall line of the James River, approximately 100 miles south of Washington, D.C., 100 miles west of Virginia Beach, and 100 miles east of the Blue Ridge Mountains and the Shenandoah National Park. Richmond's revitalized downtown includes the Canal Walk and numerous performing arts centers. It is home to many amazing museums, including the Virginia Historical Society, Virginia Museum of Fine Arts, the Science Museum, among many others. It is also home to the ballet, the symphony, and the opera. Anyone from Richmond will tell you that Richmond is known for its food scene, breweries, and distilleries. At the heart of downtown Richmond is Vcu Medical Center, previously known as the Medical College of Virginia. Given our central location, we have a very large catchment area drawing from the entirety of the state and surrounding states. VCU is known for its diverse pathology, encountered both in the inpatient and outpatient settings. VCU Medical Center has 865 adult licensed beds. The VCU Children's Hospital of Richmond is also located downtown with the new Children's Hospital currently under construction. The neurology clinics downtown are currently housed in the Ambulatory Care Center, but they will expand to the VCU Health Adult Outpatient Pavilion, which is also currently under construction. There is a very large neurology presence at the Neuroscience Orthopedics and Wellness, or NOW Center, west of downtown. This houses clinic space, the multidisciplinary MDA and ALS clinics, and its own infusion center.
Hi, I'm Gordon Smith. I'm professor and chair of neurology here at VCU and a proud member of our neuromuscular team. And in thinking about what I find particularly exciting or fulfilling about working here, I'm reminded that there really are three things that drive our satisfaction in the workplace. The first is feeling like we're part of a winning team, that we're champions and doing great things. But more important than that, we need to feel like we're part of a noble cause. And then lastly, we need to have fun doing it. And I think we have all of those here. But it all begins with the team. We have an outstanding team of neuromuscular faculty, 8 core faculty who've trained at some of the best programs in the world, including the Brigham, Hopkins, Michigan, Rochester, and others. But more importantly, this group works as a team. They're very mutually supportive of one another. We work well together, and we're very passionate about our education mission and supporting students, residents, and particularly our neuromuscular medicine fellows. And we share a noble purpose of bettering the lives of patients with neuromuscular disorders, and in particular, trying to discover new treatments or cures for these problems. And we approach this through a large and robust research program that is well funded by NIH and major foundations. We lead multiple national and international clinical trials and consortia, and clearly it's important for our fellows and residents to participate in this mission to learn how they can carry the torch going forward. Another part of our noble purpose really is serving our community. And we do this, of course, by providing outstanding patient care to an incredibly diverse group of patients who have very complex neuromuscular problems. But we do it also through leadership and national and international leadership in our organizations. And many of our faculty have leadership roles in the American Academy of Neurology, the AANEM, Muscle Study Group, Peripheral Nerve Society, and others, which is not only fulfilling, but it really drives our impact, which is part of our noble purpose. And lastly, we're having a great time doing it. It's a fun and exciting place to work. We have a large and growing department. I think we're the most exciting part of that department, but I'm biased. We have many other amazing teams working together. We're well-resourced. We're building new facilities. And so if you're interested in joining a very exciting, vibrant neuromuscular community, participating in our noble purpose, and being part of a winning team, we hope to see you here in Richmond, and would very much like to see you come join us here at VCU.
My name is Tina Du. I'm one of the neuromuscular practice here at VCU. I am board certified for neuromuscular medicine and elective diagnostic testing. I see outpatient neuromuscular patients and routinely staff the EMG lab. On Friday morning, I work with a fellow during the neuromuscular fellow continuity clinic rotation. About a quarter of my time, I also do EMG guided chemodenervation for a variety of conditions such as cervical dystonia, limb dystonia, spasticity from MS, stroke, or upper motor neuron predominant neuromuscular conditions. I think VCU is a great place to get neuromuscular fellowship training. It offers a wide variety of pathology, and the faculty here are capable of providing you with in-depth training in almost all those sub-areas. I'm looking forward to working with you.
Hi, my name is Dick Johnson. I'm Vice Chair of Research, Director of the Mda Clinic and the Muscular Dystrophy Translational Research Program. I'm excited you're thinking about VCU for your neuromuscular fellowship because I think we've got a lot of great opportunities for you to provide you all the training you need for your future career. With me, you'd be interacting in a few different ways. Number one, you'll be attending the Mda Clinic, which occurs on Tuesday morning. This clinic has a true multidisciplinary clinic with all the therapy services, genetic counseling, social work, nurse navigation, and beyond. And we see great patients from all over the Mid-Atlantic, up and down the Eastern Seaboard, and beyond with a variety of genetic nerve and muscle disorders. I'm also excited about that clinic because many of those patients will be participating in a number of precision therapy trials that will be starting probably over the course of your fellowship, actually, as the leading center of research across muscular dystrophies. Beyond that, we would be interacting during your neuromuscular pathology service time. I am UCNS board certified in neuromuscular pathology, and you would be assisting me in interpreting nerve and muscle biopsies. I think this is a pretty unique part of our fellowship, and I'm excited that you'd be able to participate in that, as well as our neuromuscular pathology conference, which occurs once a month in conjunction with our neuropathologist, Dr. Richard. With all that, lots of great opportunities. Thanks for thinking about VCU, and I hope we see you soon.
I'm Dr. Amy Harper. I'm a pediatric neurologist and neuromuscular specialist. I am the director of the Pediatric Neuromuscular Clinic, and I see patients both with muscular dystrophy and nerve problems, both in the clinic and in our comprehensive neuromuscular clinic, where we see patients with Duchenne's muscular dystrophy and spinal muscular atrophy as well. I incorporate our neuromuscular fellows into our neuromuscular clinic for their multidisciplinary education, so they know how to care for all aspects of those children.
Hi, I'm Kelly Gwathmey. I'm the Division Chair of the Neuromuscular Division at VCU. I'm also the Program Director of the Neuromuscular Medicine Fellowship Program. I was fortunate enough to join VCU in early 2019 to help grow the training programs and contribute to clinical research. Our division has 6 adult neuromuscular faculty, 2 pediatric neuromuscular faculty, and a neuromuscular nurse practitioner. We have a bustling weekly MDA and ALS clinic with 10 core team members as well. We were fortunate enough in the last year to be approved to expand our neuromuscular medicine fellowship to 2 positions per year. So what would your life look like as a fellow at VCU? So every day of the week, you rotate with a different attending. On Mondays, Wednesdays, and Thursdays, you rotate through the attending academic clinics. So you go with the attending in the morning to their clinic, and then you join them in the EMG lab in the afternoon. On Tuesdays, you are in the multidisciplinary MDA clinic in the morning and the multidisciplinary ALS clinic in the afternoon. Our ALS clinic is supported both by the Muscular Dystrophy Association and the ALS Association. On Fridays, you have your own longitudinal continuity clinic in the mornings. There are additional clinic opportunities that you will rotate through as a fellow at VCU. These include the Multidisciplinary Sarcoidosis Clinic, the Pediatric Multidisciplinary Clinic, and the Pediatric EMG Lab. In terms of procedural experience, our neuromuscular fellows have on average 3 half-days of EMG per week. They have ample exposure to single fiber EMG, repetitive nerve stimulation testing, blink reflexes, exercise testing, and other less utilized nerve connection studies. Our fellows also triage inpatient EMG requests, and they average about 1 to 3 per week, and they also participate in inpatient neuromuscular consultations. Our fellows also have the opportunity to learn muscle biopsy, chemodenervation for spasticity, and participate in skin biopsies. In terms of didactics, the fellows have a very rich didactics experience. Every week I meet with them for half an hour to 60 minutes to review assigned readings and podcasts. This is in addition to the core 21 neuromuscular lectures that are provided every year for the residents and the fellows. Additionally, the fellows will participate in these by giving 1 to 2 lectures per year. We have a monthly EMG and Interesting Case Conference, as well as a monthly Neuromuscular Pathology Conference. Journal clubs occur throughout the fellowship as well, and all VCU neurology trainees are expected to participate in grand rounds on Fridays at noon. With regards to research, the fellows are encouraged and expected to participate in research as acting sub-investigators on clinical trials. Also, our fellows are expected and encouraged to participate in their own research project, which we will mentor them in during the duration of their fellowship training with us. So in summary, the VCU Neuromuscular Medicine Fellowship provides exposure to a wide range of neuromuscular disorders, varied pediatric and adult neuromuscular clinics, and electrodiagnostic training. Our internationally renowned faculty, expansive facilities, and diverse pathology provide the necessary learning environment to prepare any trainee for a successful career in neuromuscular medicine. Thank you so much for your time, and if you have any questions, please do not hesitate to contact me.
We're going to go ahead and go into the question and answer. I will get it started. One of the questions that Sherlyn Atkins has been asking everybody is, can you share with everybody why you chose neuromuscular medicine? What drew you to neuromuscular as opposed to any other specialty?
I think that no doubt, I think that neuromuscular encompass probably the broadest type of variety of diseases. And so you will never stop learning and you will never be bored. There are so many different diseases, different ages, and different mechanism of action. And also because I had an idea that probably we were at the frontier of new disease-modifying treatment. And I guess I was proven right, because right now neuromuscular is leading in genetic modifying diseases, and probably one of the most amazing things that ever happened to neurology is gene therapy, and it's happening right now in neuromuscular diseases. So I think it's an incredibly exciting field with a lot going on, so a lot of variety.
I'll just echo some of what Emma said. I really find it intriguing because there's such a wide variety of different age patients that we take care of, from children all the way up to someone who's 100. from very treatable conditions like our autoimmune neuromuscular junction disorders and neuropathies to our neurodegenerative conditions. I like the balance of being able to do procedures some days and also seeing patients in a clinical setting other days. So it's a really nice variety and balance for me.
So, I mean, so for me, I, like Kelly said, I like doing the ability to do some procedures. One of the other parts that I realized within neurology was not just seeing pediatric patients and adult patients, but also being able to really have an interaction and teach your patients and their family about how to cope with a lot of these different things that historically were pretty devastating. And now with the advent of a lot of the treatment options, restoring some quality of life to a lot of the patients, thinking about things like autoimmune mediated neuropathies or myopathies. And I think that's a large part of what drew me to having a gratifying clinic experience.
Yeah, I think for me, it was similar. I think there were sort of two big things. One was the patient population. And I feel like there were just so many interesting questions to answer in neuromuscular that, as everybody has said, we're now answering and bringing new treatments to the forefront. But also I liked the ability to sort of take care of every aspect of a patient, from diagnosis, electrodiagnostics to treatment. And I don't feel like a lot of other specialties can always say that. And then the other big one for me was the other people on this video call and the people that were in the VCU video is the neuromuscular community. I love working with all the other neuromuscular people around the country. It's one of the most friendly communities within neurology. And that was a huge sell for me.
Is there any one particular thing about your program that is unique that would be where they should come to your program as opposed to any other program?
Well, I think that for Rochester is the breadth of our neuromuscular faculty. Is not only a very large group. Obviously, we have a very large neuromuscular division with 12 faculty, but is also the tradition. We've been in the neuromuscular field and clinical research and trials and teaching for a very long time. But I think at the end of the day is because it's a very friendly place where people really enjoy to teach and learn. We try to keep stress low and learning and having fun learning high. And that's at the end of the day is what counts. The other important factor is that we have a very highly committed patient. We have probably an extremely low no-show rate in all of our neuromuscular clinic and in the EMG. And again, the breadth of different pathology and patients of all ages. For me personally, right now, I think that being a referral center for newborn screening is one of the most exciting, obviously, because we do gene therapy on a monthly basis. That's obviously is very exciting as well. And then the opportunity to be exposed to very high level clinical research and clinical trials. And if that's of interest to fellow, the experimental therapeutic and do a second year for research is a pretty unique and great opportunity.
I think in Vermont, I think one of the strengths, we're a smaller program, but I think that's a strength of ours because there's a lot of individual attention to each fellow when they come through the program. And despite the fact that we're a smaller center, we're a very well represented and active neuromuscular group. I have a non-physician friend in town here in Burlington, and he always says that Vermont always seems to punch above its weight nationally for just about any issue politically in the news. And I think we do that in neuromuscular as well. We're a small group, but we are a well-funded group that does a lot of clinical and translational research. So I think, and we're able to represent all facets of neuromuscular here. So I think those would be our two.
All right, Guillermo, I don't see you jumping at it. I'll take it next. Well, I think we're doing great work at VCU. I think our trajectory is just upwards. Our chair is a neuromuscular neurologist. Our vice chair of research is a neuromuscular, Dr. Johnson. We are hiring another faculty member who starts in August. We have a couple others that we're interviewing at this present time. So there's so much growth, not only in our division, but also in our department. I think we've hired 18 new faculty in the last year. We have 55 active neuromuscular clinical trials. And then just 3 years ago, there were probably less than 5. So, I mean, it's just a very exciting place to be. Not only is Richmond fantastic, I am biased because I was born and raised here, but I think it's a really fun environment to be in when every month something new is coming, a new trial, a new faculty member, new research. I mean, it's just really fun. So, and it's a great collaborative environment.
I think for us, I mean, we're not a large one, but I think a lot of the time is being able to work with some of the people that have been doing this for a long time, with Larry Phillips and Ted Burns, and having that sort of history of people that are very important in the neuromuscular community. And as we kind of move forward and grow, and we're hiring for new faculty members in both pediatrics and adult for neuromuscular to try to sustain that excellence and move forward to try to take care of, I think the strength of our program is more ALS based, and participation in ALS trials, and a dedicated group of people with therapies and physicians to the care of ALS patients in Virginia. So those are the things that I think set this program apart.
Thank you. All right, one of the other questions we had the other night is, do you consider PM&R applicants?
We do at VCU.
We do as well.
Could you repeat the question? I'm sorry.
Yes. Do you consider PM&R applicants?
Oh, yes. Yes, we do. In fact, our incoming fellow is a PM&R resident from University of Michigan.
Yeah, same in Rochester. We didn't used to, but now we are.
How often are fellows able to assist, consult on inpatient neuromuscular management?
So I'll take that on. I mean, so one of the other hats that I have is I think Kelly and Mike know, as far as being a neurohospitalist. And so getting the fellows involved in the management of inpatient neurology is important for either myasthenic crisis or exacerbations, the rare patient that presents with ALS or muscular dystrophy or myopathy. So it's a way that I can directly impact how the fellows are participating on the inpatient management of the neuromuscular patients.
So in Rochester, we have 3 neuromuscular fellowship positions. So we have 3 fellows. So each fellow takes 4 months of covering the inpatient consult service for neuromuscular, which is very different. So we do have general neurology resident taking care of all the inpatient consult, but the neuromuscular fellow are called for special complex cases and participate in the care, but more into almost like a junior faculty in terms of directing the treatment and the diagnostic testing, and obviously always with one of the neuromuscular faculty there is always a neuromuscular faculty on call for inpatient consult. So they help managing, but at a higher level than a resident. And they get exposed to, a number of diseases, even the ICU and the floors.
Ours, I think, runs very similar to Rochester's program, where we'll have the fellow consult on patients and sort of help direct care for the residents with guidance from us. And then we also prioritize the inpatient electroddiagnostic studies for the neuromuscular fellow. We make sure that they try and do almost all of them.
We're set up in the exact same way. So our fellow and soon to be 2 fellows triage all the inpatient EMG requests and work with the inpatient neurology team to understand what the question is. And then separately, we do provide inpatient neuromuscular consultations as well.
I want to thank all of you so much for presenting tonight. I know you have busy schedules, so I appreciate you taking your time and presenting and sharing your program and information about your fellowship. All right, as we wrap up, there's a couple of upcoming events that we just want to make sure that everybody is aware of. We do have the Spring Virtual Conference coming up March 2nd through the 5th. So you probably have seen some advertisement for that. For you residents and fellows, just be aware that registration is free. So you are able to attend that at no cost to you. So it's a wonderful opportunity for you. Those that are going to be taking for the neuromuscular and EDX self-assessment exam, that's happening May 3rd through the 10th. So please contact your program coordinator to register. And then our big meeting, the AANEM annual meeting, will be coming up October 13th through the 16th in Aurora, Colorado. So hopefully this pandemic will be done by then and we'll be able to see everybody in person. Residents, please reach out to the programs either through the portal or through the email addresses that they have shared with you. They're more than happy to answer any other questions that you may have. So with that, I will say good night.